For years, the gold standard in regenerative aesthetics operated on a brutal logic. Looking younger required physical trauma. Meaningful skin tightening meant enduring pain, intentionally puncturing the face with needles, and spending days hiding at home while the swelling subsided. Today, patients face a different dilemma. You want firmer skin and a sharper, more defined jawline, but as a busy professional, a parent, or an executive, taking a week off to recover in hiding is impossible. The market has responded with an overwhelming alphabet soup of acronyms and devices claiming to solve this. If you start researching, you are immediately hit with memes like Thermage, Sofwave, XERF, and RF microneedling. This matrix maps out how we are going to evaluate these options. We are judging these devices based on a strict set of criteria: the downtime required, the amount of surface trauma inflicted, the target depth of the energy, and the actual physical comfort of the patient in the chair. When you look closely at these columns, surface trauma and downtime are the primary deal breakers. Notice how RF microneedling registers high for both, while density RF registers at 0. The financial reality here is stark. These aesthetic treatments cost thousands of dollars. Enduring unnecessary pain is a clinical failure and a financial one. You are spending significant money on energy that isn't reaching the tissue needing it. Choosing the right technology is about matching the specific physics of a device directly to your biological needs and your lifestyle constraints. To understand how these devices work, we have to look at the energy they use. Radiofrequency, or RF, is simply a type of electromagnetic wave. It sits in the exact same category of energy as your home Wi-Fi router. When these specific RF waves enter human tissue, they encounter physical resistance. That resistance generates a highly controlled, precise heat, usually hovering right between 40 and 45 degrees Celsius. That specific temperature acts as a trigger. Youthful collagen proteins are naturally shaped like tight, twisted springs. As we age and sustain sun damage, those helices loosen and degrade, which is the physical reason our skin begins to sag. When the targeted heat from the RF energy hits those old, degraded collagen fibers, the chemical bonds break down. The old structure melts. This intentional heat damage sounds an alarm in the body's immune system. Specialized cellular factories, called fibroblasts, rush into the area and immediately begin weaving brand new, tightly bound collagen and elastin to repair the perceived injury. Traditional RF microneedling achieves this by driving physical metal needles completely through the epidermis to deliver the heat. Pure energy platforms, however, send invisible wave vectors straight through the intact protective layer of the skin, depositing the heat entirely below the surface. Intentionally creating microwounds is effective if your goal is to physically remodel severe acne scars, but that physical damage guarantees redness, swelling, and recovery time. If your primary goal is structural lifting and tightening, choosing a treatment that requires you to physically puncture your skin is an unnecessary biological and lifestyle compromise. To bypass the surface, the aesthetic industry relied heavily on monopolar RF. This is the technology powering legacy devices like Thermage and newer single-energy platforms like XERF. Monopolar RF operates on a very specific physical circuit. The energy leaves a single wand pressed against the patient's face, and it actively travels deep through the body to seek out a distant grounding pad, usually placed on the patient's lower back or thigh. Because the energy is physically pulled straight down through the tissue, it successfully targets the deep foundation of the skin. It repairs the heavy, load-bearing structural layers. But there is a biological mismatch here. A human face is not uniformly thick. You have deep fat pads along your jawline, but the skin on your forehead and your neck is paper thin. This creates a single depth trap. If a provider wants to tighten that thin surface skin, they can't simply turn up the power on a monopolar device. Doing that forces a wider cone of dangerous heat down into the deep tissue, because the circuit is always seeking that grounding pad. Pushing too much heat into the deep tissue triggers the nerve endings, causing acute pain. Worse, it risks accidentally melting the youthful fat pads that actually give a face its natural structure and volume. Single energy platforms force the clinician to make a choice: either keep the power low and undertreat the surface to protect the deep tissue, or crank the heat and subject the patient to pain. The engineering solution to this problem is bipolar radiofrequency. It allows a provider to target the superficial layers without endangering the deep tissue. In a bipolar circuit, both the positive and negative electrodes sit directly next to each other, right on the handpiece. There is no grounding pad on the back. The energy arc loops tightly between those two pins, keeping the heat isolated to the top fraction of the skin. This shallow penetration allows the provider to execute precision repair, smoothing fine lines and surface laxity directly at the top of the dermis, leaving the deep fat layers unaffected. Density RF is categorized as a dual energy platform, specifically because it physically houses both the monopolar and bipolar circuits inside a single handpiece. By firing these two distinct energies sequentially, the provider can repair the deep load-bearing foundation and perfect the surface in a single pass. You get comprehensive remodeling at every depth without ever needing a needle. Historically, patients researching skin tightening were terrified of the pain. Older monopolar treatments often required strong pain medication or actual nerve blocks just to get through a single session. Because density RF constantly alternates between deep monopolar and shallow bipolar frequencies, it prevents any single deep zone from overheating. The tissue reaches the optimal therapeutic temperature for collagen production, but it never spikes into the pain threshold. And because the electromagnetic waves bypass the epidermis entirely, the skin's surface barrier remains intact. There are 0 open wounds. You can walk out of the clinic and straight back to your life. This adaptability provides clinical versatility, allowing a single session to transition from tightening thick abdominal tissue to delicate areas like the décolletage or the back of the hands. Integrated real-time cooling mechanisms continuously protect the surface layer. The result is a treatment that lets patients return to the gym or step right into the boardroom immediately. When you remove the physical trauma and eliminate the pain, you remove the primary psychological barriers to aesthetic treatments. High-level cellular remodeling is suddenly accessible to adults who cannot pause their active lives. But we have to look at the absolute limits of this technology. An energy device does not excise excess skin. If a patient presents with severe, advanced laxity, they still require a surgical facelift. The ideal candidate here is seeking natural-looking contour refinement. You are waking up the skin's structural integrity, not making extreme architectural changes to the face. The biological timeline requires realistic expectations. While the immediate heat causes existing collagen to contract, giving you a flash of tightness right away, true cellular remodeling is a gradual process. Peak structural results manifest 3 to 6 months post-treatment. This quadrant chart plots the financial cost of these procedures against their lifestyle disruption. Density RF sits distinctly in the high-cost, zero-disruption quadrant, while older needle-based methods pull you into high-disruption territory. The premium pricing of a dual energy platform is an investment in highly calibrated physics. You are paying for the precision required to comprehensively treat the tissue without wasting money on older, painful, or single-depth alternatives. For the time-poor patient who refuses to compromise on results or comfort, Density RF establishes a clear standard. It proves that reversing the degradation of your skin no longer requires physical trauma. It simply requires the precise application of energy.